So let's start with the topic of elbow anastomosis. So it's very important for us to understand elbow anastomosis. The anastomosis source is the arteries, that is the brachial artery, the profunda brachii artery, and also the radial and the ulnar artery. So these are the important source of the arteries forming the anastomosis, and we will understand the anastomosis which is taking place on the medial aspect of elbow joint, on the lateral aspect of elbow joint, and also we will see the anastomosis which is taking place anteriorly and posterior aspect. So for that, firstly I would like to explain it and then I will write it for you. So here we can see this diagram. This is a schematic diagram where you can appreciate here the brachial artery is there, which is the source of important arteries forming anastomosis. This is the another source of artery, profunda brachii artery, and the other two arteries are the radial and that of ulnar artery. So these four arteries, so these are the four arteries which will form an important anastomosis. Let me just highlight this. So yes, now after highlighting the source of the artery, I would also like to write the side, which is the medial side and which is the lateral side of the elbow joint. We know that elbow joint is formed by the lower aspect of the humerus bone and the upper aspect of the radius and the ulnar bone. Okay, so we are knowing that, and we are also knowing that the radial artery will be on the lateral aspect and ulnar artery on the medial aspect. So yes, this is quite clear. I am writing here M, that is medial side, and I am writing here L, that is lateral side. Okay. Now, the important source of anastomosis at. Now, I also want to name two arteries which is not labeled here, these two arteries. Okay, these two arteries. Okay. So, the one which is lying above, this is superior ulnar collateral artery. The one lying below is inferior ulnar collateral artery. Actually, when I am talking about superior ulnar collateral artery and inferior ulnar collateral artery, they are directly the branch of brachial artery. Now, that is clear. Now, as I told you, on medial side of elbow joint, there is anastomosis both on anterior aspect and on the posterior aspect. So, for that, let's see here. So, on the anterior aspect of the medial side of elbow joint, these two arteries are anastomosing. And what is that artery? These two arteries are inferior ulnar collateral artery is anastomosing with that of anterior ulnar recurrent artery. This is the anastomosis which is taking place. Okay, so this is the first anastomosis which I have highlighted here on the medial side. On anterior aspect, inferior ulnar collateral artery and anterior ulnar recurrent artery. Inferior ulnar collateral artery branch of brachial artery, anterior ulnar recurrent artery branch of ulnar artery. Now, the anastomosis which is on the posterior aspect of the medial side is between superior ulnar collateral artery and that of posterior ulnar recurrent artery. Here, superior ulnar collateral artery is a branch of brachial artery and posterior ulnar recurrent artery is a branch of ulnar artery. So, this is which anastomosis? This is the second anastomosis. Okay, this is what? This is the second anastomosis. So, done. Now, let's focus on to the lateral side of elbow joint. So, we have finished with these two anastomosis which is happening on the medial side, one anteriorly and other P for posteriorly. We have finished this. Now, let's focus on to the lateral side. When we see the lateral aspect of elbow joint, we can clearly appreciate that radial collateral artery. Now, we know that just now I have explained to you about radial collateral artery. The other name of radial collateral artery is, it is also called as anterior descending artery. And if you remember the previous topic discussion where I have explained the branches of profunda brachii artery, we know that two branches of profunda brachii artery is there. One is anterior descending, which is also called as radial collateral artery, and the other is posterior descending, which is also called as middle collateral artery, which is also called as middle collateral artery. Okay, now here radial collateral artery here is anastomosing with this artery. What is that name? The name of that artery is Radial recurrent artery. So what we can appreciate, radial recurrent artery is forming anastomosis with radial collateral artery. Radial recurrent artery is a branch of radial artery. Radial collateral artery is a branch of profunda brachii artery. So this is the third anastomosis. This is the third anastomosis. Actually, this is the anastomosis on the lateral side anterior aspect. Now, let's see the fourth anastomosis. This is between the posterior descending artery, which is also called as middle collateral artery, which is forming this anastomosis, which is forming an anastomosis with intraosseous recurrent artery. So here intraosseous recurrent artery is anastomosing with posterior descending artery. The other name of posterior descending is middle collateral artery. Why I am repeating these things? Why? Because sometimes if they use the other name of that artery, please don't get confused about that. So here we can clearly appreciate the anastomosis, intraosseous recurrent artery, anastomosing with posterior or descending, also called as middle collateral artery. Now my dear aspirants, now the other point which must be coming in your mind